Good morning. We're back at AONE 2019 in beautiful, sunny San Diego, California. I'm joined this morning by my special guest, Dr. Glenn Raup. Dr. Raup is the Executive Director of Emergency Care Center, Behavioral Health, and Observation Services at Providence St. Joseph's Hospital, Orange County. Whew. Did I get it?
It's a mouthful. There's no doubt.
Welcome, Dr. Raup.
Thank you.
It's a pleasure to have you here. So, I mean, obviously, you run one of the largest, or the larger, I guess, emergency departments under the Providence St. Joseph Health umbrella, right? In the metropolitan LA Orange County area. We've said that before. So your nursing team must face many of the common problems we see in healthcare today, right? The long patient wait times, staff burnout, and challenging measuring against patient satisfaction scores, et cetera, et cetera, et cetera. So you must have such a wealth of information and knowledge. So what are some of the ideas you've implemented to help assist in improving your clinical operations?
Absolutely. A big focus for us, and a big focus for me, is data. And the more I can have the accurate, timely data, the more I can make decisions that can really have a positive impact on our patient flow, patient satisfaction, all the different outcomes that you've already mentioned.
Right.
And so getting your hands on that data, there's a lot of it, but getting your hands on that data in a timely manner and being able to use it to make decisions is absolutely critical. And so one of the things in trying to pull data from electronic medical records and other sources is how do you do that in a cohesive and coherent manner so that you can be able to make decisions. And the other piece that you have to struggle with is whether or not that data is entered in a timely manner, is manipulated upon entry, and so forth.
Right.
So we sought out to find a solution that would be able to eliminate that, provide us with real-time information, real-time data, that we could look at our processes and be able to marry up that information with our electronic medical record and other traditional sources of information. And so we were able to find a company, Tagnos, and they provide us a clinical emergency department software solution platform that actually pulls in using RFID data through an RTLS real-time locating traffic system, whereby it looks at information on a real-time basis, provides that information back to us as clinicians, and then we can really see the process of what's occurring in the patient care continuum. That information has at its core, which is near and dear to my heart, the accuracy.
Okay.
It's happening real time. It's happening not contingent on someone entering information, but actually what is happening with the patients or the providers, nurses, physicians, etc. And basically, very, very briefly, not to spend too much time on it, it really requires simply a tracking device that is put on the patient at the time of arrival, and for lack of a better word, tracking device that the staff have as well. And then certain point-to-point systems all throughout the emergency department and all throughout the hospital and certain key points whereby we can track that information. So all the provider, all the nurse, all the physician, all the ancillary staff provider has to do is do what they do best, provide care for the patient. The information is tracked automatically.
Okay.
Likewise, when the patient moves through that system, same thing. Those time intervals are tracked automatically. And that provides such a wealth of information, absolutely, to be able to make decisions.
So, so you've got all this data. So what are the results? What are you seeing from a results perspective in the real-time data acquisition?
Absolutely. So obviously we started with the key things that we wanted to look at were key clinical processes such as stroke, STEMI, sepsis, the things that all emergency departments across the country are struggling with. And came into it with patient satisfaction as well, looking at that being one of the outcomes. What we were able to do is look at the processes and then overlay that data on top of that, and it really provided us with some very eye-opening experiences. For example, we found that we could easily track the time the patient was put in the room to the time the provider or the nurse got in the room. No problem. Yeah. But then we were able to see what that impact has when how long they spent in the room, and then the impact that it had for how many times they went back to the room. All of these things were collected automatically within the Tagnos system, And we were able to marry that up with our patient outcome scores. And it really provided an eye-opening experience for our physician partners, as well as for some of our nurses. Things that they traditionally thought made the patient satisfied actually didn't, and didn't have meaning for the patient. And that was a really value-added benefit to this process.
So a win for the hospital, a win for the patient, and a win, for the practitioner, obviously, because of the amount of information that you're gathering. That's amazing. So you're sold on it. What advice would you give to other hospitals or health systems that are looking to implement similar applications? I mean, you must have learned a lot in that, that process.
Absolutely. We're all struggling with the cost of IT and the cost of all the different things, and IT is changing so rapidly. Mm-hmm. What my advice would be that if you can implement a system such as this, the beauty of it is that the data that you get back is so rich and so powerful, and it's not contingent upon someone entering it at a time that's convenient for them or changing or manipulating. It's just based on the practice of what you do in providing care. And so I would strongly recommend someone reaching out and finding an organization such as this to be able to partner with them to look at using the infrastructure of wireless technology and being able to track that, track the patient movement, patient flow, and marry that up with your clinical outcomes data. If you can do that, it actually, in today's very complicated IT world, provides a low-tech, simple solution that is incredibly rich with data. And I think that's the most important aha that I could give to anyone considering, how do I get my hands wrapped around this mountain of data that we know we collect already? Yeah. But everyone struggles with the accuracy and the timeliness of it. There's not enough hours in the day to document the myriad of things that we're supposed to do. That is something that every clinician, every provider has to find time for. But if they can just do the patient care and not worry about what happens in that process and have a software solution that can track that, that makes it so much more value added, so much more value added. And then when you pull in all of that data, it makes it a strong, compelling case for looking at a variety of outcomes, from process to patient care, to provider satisfaction, to patient satisfaction, and the list goes on. And so my advice would be definitely invest in it, definitely look for those solutions such as Tagnos and that, in a way that you could be able to provide a very simple process that gives you so much information in a real-time format. That's the strength and the power of this process.
Fantastic. In this short time, I know we have just skimmed the surface of what is probably a very in-depth conversation and explore. Would you mind if I offered up to our viewers the opportunity to connect with you post-event?
Absolutely.
Okay, so for those of you that would like to know more about systems such as Tagnos, please feel free to contact A1E, and we will give you Dr. Raup's contact information or make some way to connect the two of you, and you can explore further with folks and give some more feedback and certainly explore your experiences. Is that fair?
Absolutely. From a clinical perspective, practicing in the hospital, emergency departments, as busy as we are, this represents a great solution.
Well, I appreciate your time today, Dr. Raup, and we wish you the best of luck at A1E 2019.
Thank you.
Thank you.
Really appreciate it.
Appreciate it.